There is no treatment for concussion. This is wrong. The effective treatments for concussion have been found to be rehabilitation, visual, ocular, motor, exercise, treatment of the neck, not just passive treatment of the neck, but also active treatment of the neck and rehabilitation and movement patterns and cervical joint reposition error testing and all of these different things. Diet, cognitive behavioral therapy. There's a number of different treatments for concussion, and oftentimes they're done simultaneously, comprehensively, because there's a lot of different pieces that all kind of come together. If you do one, like say, if you're thinking, well, I did vision therapy and that didn't help, and then I went over and did vestibular therapy and that didn't help, well, the reason is probably because you did them as independents. What needs to be done is you have to kind of do this as a comprehensive piece, because what's happening in the visual system here may need a little bit of vestibular work to help coordinate it. Similarly, there may be some neck issues that are impeding your vision therapy. So if you're getting all this vision therapy and it's not helping, something's being missed. There may be a vestibular component or a cervical spine component that's being missed, or even a psychological component that's not being dealt with that is affecting the outcomes of your treatment. So there is treatment for concussion, but it's all basically rehab based. You have to do the work. You can't sit there and get somebody to electromagnetic pulse your brain back into, reality and make it work again. It's just not how it works. You have to do the work to make it go, right? How did you learn to walk? It wasn't by watching other people walk. It wasn't by electromagnetic pulse stimulation. It was by walking, making mistakes, falling down, getting back up, learning how to navigate your environment. This is the same thing with concussion. How are you going to learn to drive again? How are you going to learn to navigate your environment again? You're going to have to go and do the work. You're not going to get better with a passive treatment modality. You have to put in the work. So stop looking for the ozone therapy, laser therapy bullshit out there. Just start finding concussion rehab centers that are qualified and trained, and let's start doing the actual work. Now, I will say that the only somewhat passive modality that may have some early evidence to support it is something like a hormone replacement therapy. If there were some hormone imbalances that were off, that is something that would classify technically as a pill or a passive modality that may have some benefit. But other than that, you're going to have to do the work.